Nine people.
9 people. I'm very excited. Okay. I think we'll give it until, well, my clock says 5:03. So I'll just give it another couple of minutes and then we'll have to begin and crack on. Oh,
Yeah.
perfect.
Yeah, 11 people. So I received like three more confirmations of people. So people have just signed up as well. So
Oh, great.
1 minute before there were like 3 more tickets.
Okay. I need to listen to this. Okay, go down.
Oh, hi guys. If you could all do me a huge favor and mute yourselves, that would be fabulous. Bar Isabella. Thanks, guys. Okay. Okay, shall we begin? Isabella, do you want to crack on?
Yes, let's begin.
Let's begin. Okay, perfect. Well, welcome everybody. Thank you for taking the time out of your day to come to this free financial wellness webinar. I'm Anisa Zaman, and I'm the founder and director of Rizq Communications. So I provide strategic communications for ethical brands, and as well as that, I provide financial literacy events and webinars, mostly to those of disadvantaged backgrounds and more specifically catered towards women. So I've teamed up with Elefinti, and kindly Isabella is joining us on our webinar. So I'm going to hand it over to Isabella to discuss Elefinti.
Hi, yes, so we are a fintech company. We're looking to improve the financial well-being of people that are living paycheck to paycheck. So we have developed a money app. We're working with partner institutions, and to help during coronavirus, we have launched this Coronavirus Lighthouse webpage, which you can visit. We'll send you the link afterwards, but it's a web space where you can find the information you need in 3 clicks. So for example, if you lost your job, you can find the information you need in just 3 clicks. So yeah, our vision is to improve the financial well-being of people, and this financial education is very important for us. So yeah.
Perfect. Thank you so much, Isabella. So as I mentioned, Rizq has teamed up with Elefinti in order to help people overcome the sort of financial situation they may find themselves in at this moment in time. So just to walk you through a little bit more about what we're going to be covering during this webinar, we're going to be taking a look at those living check to check, and this predominantly affects those of a BME background, those of a working class background, women, as well as the elderly. And what we're going to do is looking at 3 key topics, primarily housing, as well as wealth, and of course health and how they interlink, and then providing tips and advice for you to kind of better inform yourself and find ways to alleviate some of the pressure you may be finding yourselves under at this moment in time. Of course, we'll be following this webinar up with a free toolkit where you'll find links to helpful sites, hotlines, as well as sort of tangible help and tips that you can take forward and execute during this period. So without further ado, I'll be carrying on with this presentation. So this is just to sort of primarily tell you a little bit more about Rizq as we kind of covered through, but with regards to sort of timing, we're going to just sort of skip through these bits and make sure we inform you thereafter within our toolkit. Would you like to speak, Isabella, a little bit more about Maysan perhaps?
Yeah, so, or we can talk about it after, we'll in the toolkit.
Yeah, okay, perfect. All right, let's go. So the first topic, we're looking at sort of key findings. So as mentioned, coronavirus has impacted, of course, swathes of people and indeed worldwide. And what we're going to be particularly focusing on is how it's affecting BME communities in the UK, the elderly, key workers and women, as we find that they are most disproportionately affected by coronavirus. So if we look at some of the impact coronavirus has had on British society at present, we're finding that 2 million jobs have been lost just within the space of just over a month. So to put that into context with regards to furlough, that's just over 9 million people have been furloughed in the UK. And if we just double back on what furlough means, essentially it's people who are currently signed, are contractually obliged by their jobs or their careers and their employers essentially. However, they're not actually technically working, and some may in the industry call it on the bench, if you will. So they're being paid hopefully up to 80% of their wage through the coronavirus retention scheme the government has proposed, and 20% has been covered or should be covered rather by their employer. So if we take that onto with regards to the key findings, we can see that in a recent poll, BME households are 46% more likely to have lost their income and jobs as compared to their white counterparts, whom have been covered by 28%. So putting that into perspective, as aforementioned, BME communities are largely disproportionately affected. And then when we look at the fact of how this intergenerationally affects households as well, it's far more of a ripple effect. So as I was going on to saying how we're going to cover health, wealth and housing, we're looking at sort of the ramifications of living check by check is going to have on these communities. So we're, for example, looking at health conditions and prior pre-existing health conditions. For example, Asian households, predominantly South Asian households, are 6 times more likely to suffer with diabetes. Now, as we understand coronavirus, this means that they are particularly more vulnerable to sort of and susceptible to the attack of corona affecting them far more so. And it's also looking into statistics later on in the presentation whereby whilst BME communities make up roughly 18% of the UK sort of makeup, and they in fact make up just over a third of patients in ICU at this moment in time. So we're looking at sort of stretched living conditions, perhaps higher rates of child poverty, excuse me, and looking at savings and financial security for those living check by check. So if we carry on, so we're looking at health more specifically at this moment in time. So whilst we're covering on and we're looking at sort of households and we're looking at women, BME communities and the elderly. So as I aforementioned, a lot of sort of BME communities tend to live in intergenerational households. So what does that mean? That may mean grandparents, it may mean aunties and uncles, parents, children, and so on and so forth. So you may have 2 or 3 generations living in the same household. And with regards to coronavirus, this may in itself pose to be a threat in terms of sort of social distancing and the access and availability of that. As we can quite clearly see, health and wealth definitely have a linear relationship, but also housing comes into that as well. So when we take a look at sort of Bangladeshi and Pakistani households, for example, they have far higher rates of heart disease as compared to their white British peers. And as we'd mentioned, having those pre-existing conditions can greatly affect how susceptible you are to not only contracting coronavirus, but rather it affecting you in an adverse manner. So if we look at also further to that, Black African and African Caribbean households having higher rates of hypertension compared to other ethnic groups, we can see that the sort of medical makeup of this suggests that BME communities are disproportionately affected by corona in comparison to their white British counterparts as a result of having pre-existing conditions. So as we mentioned, and we go on from this, we can take a look at sort of the more practicalities of things. So practical tips in terms of health. I think something that's really clear and sort of something that we can help promote further is how we're using repeat prescriptions. Now, this may be something that's really helpful and really useful during this sort of period, but it's important that we're sort of in communication with our pharmacies and whomever may be stocking those sort of vital medicines for those said pre-existing conditions. So you may already have this sort of process worked out with your GP or perhaps any other clinician you may be in sort of conversation with regards to medicines, but this is more specifically catering towards the elderly that may be living in those households. And I think it's also important to reinforce the idea of social distancing within the household with regards to those that may have contracted the virus, but we will go on to speak about that later when speaking about housing. I think it's also important to sort of understand also the effects and the ramifications of coronavirus on the elderly, on the over 65s. I think it's come to a point now, we're sort of just over a month into this sort of lockdown phase in the UK. And it's sort of important to also kind of not lose that sort of momentum of understanding the importance of protecting our elderly and most vulnerable people. So that is sort of maybe having those conversations once again, reinforcing the importance with them of staying indoors, of ensuring that their health is kept intact and managing it in such a way. I think another really sort of like quick and easy thing that I could suggest with regards to access to sort of sanitation, with regards to sort of hand sanitizers or soaps, etc. I think we're seeing now that supermarkets have started sort of building this further up now, and we're not seeing the shortages we were towards the end of March, beginning of April. But I think a quick sort of mix of rubbing alcohol along with aloe vera gel worked very, very well, or works very well rather, in terms of producing some level of sanitation and sort of a hand sanitizer as well. So ensuring that you're still keeping up with sanitation within the household, if you may need to go out, and ensuring that level of sanitation is a priority, particularly when living in perhaps overcrowded households. It's important that this is available to everybody as well. I think it's also just another factor to enforce, and we will reinforce this within the toolkit as well, is that essentially having that level of social distancing and quarantining if you feel like you're sort of contracting any symptoms, and this may affect those in your household, and particularly the elderly, quarantining them is exceptionally essential during this period. And if you do start to feel like you're picking up on any symptoms, it may be a case of calling 111, and also just immediately self-isolating. Not to negate the fact that, of course, this will have a toll on mental health, and there are many different charities working sort of and grappling with the coronavirus and the exponential rates at which they're being received, and people are calling and contacting them. But it is important to keep one's mental health also in check, and so whether that means sort of finding sort of small joys in what you're doing, whether that be a lack of screen time, perhaps taking time out to draw, to read a book, if you have access to a garden, sitting in your garden, and also as many, I believe, on the call are observing Ramadan at this moment in time, taking perhaps time out to self-reflect and have that level of sort of awareness for oneself as well, as a sort of meditative approach to the current climate we're in. The next, we're going to be covering housing and how housing will affect essentially those we spoke about. And as mentioned before, with regards to housing in the UK, and particularly with regards to women who may be finding themselves in adverse situations, either because they may perhaps potentially be in an abusive relationship, maybe perhaps because of the way in which rent and renting structures are working at this moment in time, and the relationship between work and housing as well. We will definitely go into that, as well as looking at sort of BME households and the intergenerational effect that that may have on housing, and how we can sort of alleviate some of that pressure. So once again, as mentioned, looking at sort of ethnic minorities and with regards to their housing conditions in the UK, they're more likely to live in overcrowded conditions, and as aforementioned, living in multi-generational households. So for example, you may what we have statistically found is 30% of Bangladeshi households and 15% of Black African households are overcrowded. And what this means is that there are more people than there are rooms. So you may find that you may be sharing your room with a sibling, or perhaps even sort of mixing and meshing and sharing rooms with intergenerationally as well. And that's something we'll go on to talk about later, and how we can best utilize our space within housing and the structures we find ourselves in to just alleviate some of that pressure as well. So as aforementioned as well, looking at sort of intergenerational households, Bangladeshi, Indian and Chinese households are more likely to have people over 65. So you're more likely to find those households have their grandparents living with them, and also having their grandchildren as well under the age of 16, both of which would be vulnerable groups, having small children, for example, and the elderly together. It's important to ensure that housing, with regards to your housing and spatial awareness and how things are working within the household, structures are put in place whereby you're able to best facilitate those who may be ill, may be becoming ill, or protect those most vulnerable, such as the elderly, as aforementioned. I think it's also really important to understand and highlight the relationship between health and living on the breadline. Health conditions rather have a linear relationship with housing conditions. So the more likely you are to live in overcrowded housing, the more likely it is that you may find yourself to become more ill or more susceptible to becoming ill. And it's in that case that ethnic minority groups, more specifically the elderly, are more vulnerable to perhaps contracting the coronavirus. So as we look at sort of the practicalities around housing and what we can do, as aforementioned, and I will reinforce this, it's important to sort of find a particular space where you're able to quarantine the elderly, more specifically, and that might mean reshuffling living arrangements, and those who are living in certain perhaps or rooms, or perhaps best utilizing the living room in such a way in order to protect those most vulnerable at this moment in time. Particularly if you're renting, I think it's particularly important to look at speaking to your perhaps landowner, your landlord, your landlady, your local council, or LEA, local authority as well, or your MP as well, to ensure you're in some form or other able to gain a capacity to freeze your current rate of rent. Now, what you're finding the situation may be at this moment in time, if you are renting, is that the government has imposed a law in which your landlord, landlady is unable to evict you because you're unable to pay your rent. However, it may be the case where they're able to then backlog at a certain period of time and essentially ask for the rent at a specific time at a later date. Now, if you're finding that you're living check by check, this may be far more difficult. So it's important to consider speaking with your local council, your local MP, certainly, to ensure that you're able to gain some sort of manageable financial payment going forward. And I would suggest, particularly if you're living in council housing or in a sort of a block of flats, it might be a great way to rally around people in a similar situation with you, to speak with your local MP and gain a sort of petition in order for them to take this further into Parliament and discuss this matter further as a matter of urgency. And ultimately, it's about recognising the government's accountability in providing and ensuring your safety as a resident. As aforementioned, you cannot be evicted at this moment in time. It is illegal. And as such, if you do find yourself in a situation whereby your landlord or landlady is going to evict you or is threatening you with an eviction, you can take this to court and you can file sort of a level of sort of a stop in order for them to do so, because at this moment in time, as aforementioned, it is currently illegal for them to do so. If you do, however, own your own home and you're finding slight difficulty with regards to mortgage payments, you can ask your bank for a 3-month mortgage repayment holiday. And this has also now continued on and been extended to landlords. And what that means is you can sort of postpone those payments and for that to stop. And this is particularly good if you're renting, because your landlord should also be exposed to it as somebody who is a homeowner and whose tenants are experiencing financial difficulties during the coronavirus. So this brings me on to our last topic, which is wealth. As our sort of webinar suggests, this is about financial wellness and those living paycheck to paycheck. And I can't stress enough the relationship between health, wealth, and housing, because ultimately your wealth feeds into your ability to house yourself, for you to take care of yourself with regards to health, and those living within your home. Now, if you find yourself, you may be living check to check, as aforementioned, this is a particularly hard time for many people. In fact, that the fact that the economy has shrunk by over 5% over the last month, the number of people currently in work in terms of the population is just under 1%. It's a completely sort of new and sort of harrowing way in which we're living at this moment in time, but it's also important to understand that there are ways in which we can work within the parameters we find ourselves in. So as aforementioned, with regards to wealth, living check by check is incredibly difficult, and it was incredibly difficult pre-corona as well. And that's why, with the help of sort of apps such as Elephinti, whereby you're able to become more aware of your financial budgeting and where in which you're placing your funds, that's incredibly important in order to sort of mentally compartmentalize where your priorities lie. So I would also suggest, going later on into things, checking out and thinking about the sort of apps and the way in which we think about money and where we place our wealth as a way of sort of structuring and restructuring during this period how we're living and how we're sort of surviving through this period. So what we find during this sort of period with regards to wealth is that people are living in far more challenging environments, probably the most challenging that they'll find, perhaps even in a lifetime. As many sort of economists have suggested over the last month, the coronavirus has affected people in such a way that it's far worse than the financial crisis we sort of experienced in 2008, and in fact it's leading towards sort of a depression-like phase of the 1930s. And I think it's also very important at this moment in time to consider the government and the government's role in this and what they've been rolling out thus far. which we will discuss further on, but just to highlight as a sort of pretense, looking at the coronavirus retention package, looking at how whether you're self-employed, looking at universal credit also. So carrying on from that, looking at sort of applying for universal credit and how that may work. So what the government has now done is they've ultimately changed the process so as to streamline it. So what that means is you're able to apply online within 10 minutes, fill out a form, declare how much you have in terms of savings, whether you may have any potential investments, looking at perhaps where you have and have not invested in terms of businesses as well, abroad or otherwise, and declaring that and seeing what is out there and what's available for you. So it's a 10-minute process. What I should declare at this moment in time, however, is due to the exponential rate at which people have applied for universal credit, it will be backdated. So for example, applying today on the 24th of April, you may not receive payments until June. However, the payments will be backdated up until the 24th of April, or perhaps before that, depending on your situation. So as Afa mentioned, over 900,000 people had applied since the 23rd of March. So that's just over a month ago. So as you can imagine, a lot's going on with them at this moment in time. So I think a really good and a really easy way of doing things is logging on and checking a benefits calculator on websites such as Money Savings Expert, just to give you a roundabout idea of what you can expect to receive. And that amount really does change depending on whether you're single, whether you're a homeowner, whether you're in a couple or you're married, whether you have a child. And the idea of universal credit under the current government is such that it encompasses all benefits, whether it's housing benefit, job seekers allowance, child benefit, etc., and it will give you a lump sum in that form. I think it's also important to understand sort of like 3 tips if you're particularly struggling with applying for universal credit and ID checks, is to make a note online of your universal credit journal of the problem, and ensure someone gets back in touch. So you can in fact call somebody at universal credit at the HMRC to resolve the situation. Obviously it would be much preferred to sort of go through the process online, and then sort of work your way through it in that sense. But if you're finding sort of particular difficulty with applying online, calling someone may be of benefit, and that's probably a great way to sort of connect with somebody regarding universal credit if you're somebody of perhaps an elder generation as well. And perhaps computer literacy may be slightly more difficult. Looking at if you're working from home at this moment in time, you can claim tax back on additional home expenses. So whether that's like electricity, broadband, heating, and it's sort of allowing for you to sort of claim back up to £6 a week. So it might be like quite difficult at this moment in time if you are working to sort of file a form and get your employer to sort of tick across the whole situation. So what you can do in fact is claim tax relief of £6 per week of your income of the basic 20% taxpayer rate, and it should double back and come, and it should hopefully come through in such a way. So if we now look at practical tips for wealth as well, so continuing on from that, so as of the 9th of April, the first £500 of all authorised overdrafts can be interest free. So if you're maybe perhaps a little bit financially unaware, what happened back in February was the FCA, the Financial Conduct Authority, had stated that overdrafts will no longer be part of the overall balance available, so as to provide more transparency for people to understand what is specifically their owned money and what is the bank's money in terms of overdraft that they can perhaps dip in, dip out of. Now, this was slightly bad timing on their part, but of course they weren't to know if coronavirus would affect us in such a way. But what's happened now is that they've now allowed for as an emergency situation, for the bank to be able to offer you £500 interest free. So if you're finding yourself struggling particularly, you can sort of dip into that, and knowing that it's interest free will hopefully alleviate some of that pressure. And that's particularly considering perhaps our Muslim attendees on this webinar, knowing that there isn't a particular amount of riba attached to it, hopefully will allow you to sort of some space to use that additional finance in the best possible way. And so just to mention, just sort of highlight further on, the authorised overdrafts of £500 can be interest free for 3 months. And the overdrafts under £500, the entire balance should be interest free. It is important, however, that I stress that you need to contact your bank to make sure this is all above board and you've been given the all clear, just to legally protect yourself should anything happen post coronavirus and you don't find yourself in a legal battle thereafter. So sort of going on from that as well, looking at since the 9th of April, it's also been declared that all credit cards, store credit, personal loans, catalogs must offer payment holidays. So if you, for example, may find that you've got a store card with John Lewis perhaps, or perhaps with Marks and Spencer's, they're unable to sort of charge you on that as well. They've also are now legally bound to have payment holidays. And as Afa mentioned, this is part of the recently covered consultation by the FCA, whereby consumers have a 3-day month holiday. So that doesn't mean you just outright stop payments. As Afa mentioned, you need to make sure it's above board. You need to make sure you're alerting whoever the store card holder is, whoever the credit card company may be, whichever personal loans company you may be in contact with, just to ensure that you have a level of legal protection. So knowing your rights if you've been furloughed. Okay, so just to quickly cover over this before this session ends and you're able to log back on for any additional Q&As and a wrap up. With regards to furlough, it's just to sort of simplify what the government has provided in terms of their retention payment scheme. If you do find yourself being furloughed, that means, as Afa mentioned, that you are currently on the bench. So you're technically employed, but there isn't enough work for you to carry out your job at present. So what that means is, if your employer needs to go and apply through the HMRC government website to ensure that you have access to a furlough payment. And what that means is the government is then able to pay 80% of your salary of up to £2,500, plus your national insurance contribution and a minimum pension contribution. And the rest of the 20% should be covered by your employer. I cannot stress this enough. Please ensure that if you are being furloughed, that this is the case, and that you are experiencing the full furlough sort of availability to you. In terms of sort of furloughing and whether it's the right or wrong choice and what it may be beneficial to you, being furloughed is far better than reduced hours, because you're more like, you have a better level of protection with regards to your wealth. And it ultimately, those hours can be spent elsewhere to maximize your productivity. If you are having fewer hours, or if you're on a 0 hours contract, which predominantly affects those in sort of retail perhaps, or in sort of hotels and leisure and such, which predominantly affects women, you're better off asking your employer to be furloughed as opposed to having reduced hours. If you have, however, as it stands, if you have left after the 28th of February, this has now been extended into mid-March. If you had left a job and to start a new job, and that job hadn't started, you can go back to your old job and ask for them to allow you to be furloughed, so you're on the payment roll. So just to wrap up with regards to availability and access to resources and references, we will be passing this out to everyone in terms of providing a free toolkit to help you better understand your situation, where you can go to, the kind of information available. And of course, myself and Isabella will be available to chat with. So if you have any questions, do pop them in the chat and we'll be happy to take care and answer them. This session will end in about a minute and a half. So if you do have any questions, do please jot them down in the chat, and then log back on thereafter to hear our replies. And of course, the most frequently asked questions, we'll ensure that we're putting them in our free toolkit that we're providing you with, just so you've got an additional point of reference as well. Just to further highlight Elephinti and the work they're doing at this moment in time. As Isabella kindly mentioned, there are an app and a fintech which looks to helping those most financially vulnerable, and looking at sort of helping them alleviate some of that pressure through understanding their finances through a financial budgeting app. Similarly, at Rizq, we'll be providing free webinars to those most vulnerable with regards to finances, and you can find us on our social channels at Rizq Comms on Instagram, Twitter, and Facebook. So lovely speaking with you guys, and hopefully speak with you soon, and feel free to put any questions forward once you log back on. Thanks. Bye.
Thank you. Bye. We're back, right?